Hi, this is Dr. Sosa. So I give a lot of talks about weight loss, about health, about weight loss surgery, but this is my favorite talk, and I call this a long, healthy life by the numbers. So here's the question. What three numbers do you need to have a long, healthy life? So I'm going to give you the answers. The first number is 0. Why 0? The 0 is the amount of cigarettes you should smoke. Why? Smoking is the #1 cause of preventable death in the US. So any cigarettes that you smoke will decrease your long, healthy life and will result in all sorts of health problems. The worst, obviously, is lung cancer, but others, like heart disease. So the most important number for your health, 0. Number of cigarettes you should smoke. What is the second most important number for your health? 30. People always go, 30? What, my age? I go, no, not your age. And I always ask patients this question. Do you know your blood pressure? Many patients do. Do you know your cholesterol? Many patients do. But when I say to a patient, do you know your body mass index or BMI? They look at me like, what? Is that important? Actually, that's the most important. Why? Body mass index, and I'll explain it in a minute, relates how obese you are. And we clearly have numbers. If your body mass index is less than 30, your weight, a level of obesity, is not going to hurt your health long term. You're not going to die from stroke, heart attacks due to your obesity. You're not going to usually have diabetes. So if your BMI is over 30, you are going to be much sicker and live a shorter, not healthy life. So get your BMI under 30, just so that we know. Body mass index, BMI, measures the level of obesity a person has. How does it do it? It correlates your weight to your height. So, obviously, weight alone doesn't matter, because I'll give you an example. If I don't see you, but you tell me on the phone, I'm 250 pounds, am I obese? I don't know. If you're 4'11 and you're 250 pounds, yes, you're very obese. But if you're 6'5 and you're 50 pounds, no, you're not obese. That's your normal weight. So you got to relate weight to height. That's what the body mass index does. It's a complicated formula using height in meters, weight in kilograms. There's lots of calculators online that you can do, but the bottom line is once you calculate your BMI, it is correlated to your level of obesity. Now, it is true that BMI is not accurate if you're a very muscular, like football player or major athlete. But for most of us average folks, BMI is excellent for calculating levels of obesity. So the BMI numbers have an attached survival curve to them. For example, if your BMI is 25, that's ideal. You're not going to have any health problems related to obesity, the #2 cause of death, preventable death in the US. If your body mass index is between 25 and 30, you are overweight. So when somebody goes, do I look fat in this outfit? Just go, what's your BMI? If it's 25 or under, no, that's ideal. But if it's 25 to 30, yes, you're overweight. Now, at that level, it really does not hurt your health a lot. So at that level, I tell folks, you need to keep an eye on your weight, you need to do a little more exercise, you need to cut some calories out to get your BMI a bit closer to 25. But really, 27, 28, 29, you might not be the hottest in a bikini, you might not be the great athlete, but it's not gonna hurt your health. Now, when your BMI gets over 30, it begins to hurt your health, and that's rated as obese. BMI of 30 to 35 is obese. So we begin to see high blood pressure, high cholesterol, early diabetes. We begin to see increases rate of heart attacks. And if you stay at that BMI, long term, your health is going to suffer. Not rapidly, not drastically, but it is. So what do I tell folks 30 to 35? You need to actively do something about your obesity. Whether it's with a doctor-supervised diet, maybe some appetite suppression, maybe a trainer or a psychologist to help you, but you need to actively do something about your weight to get under 30, or preferably close to 25. Next group of folks, your body mass is over 35. You are morbidly obese. Your levels of obesity are going to kill you. In the long term, you're going to lose health and years of life. So some very beautiful exercises and calculations of longevity that demonstrate the higher your BMI, the higher your death rate. The more years you lose in longevity. In other words, you're going to die younger. So folks with a BMI over 35 truly need to do something about their obesity. Now, some folks at that level are successful with diet, exercise, medical supervision. Many folks at that level are just not going to be successful with what we call medical management. And that's where obesity surgery, weight loss surgery, bariatric surgery should be strongly considered. The studies are clear. If your BMI is 35 to 40 and you have a medical problem, you should have weight loss surgery to live longer and healthier. If your BMI is over 40, even if the medical problems haven't set in yet, you should have weight loss surgery to live longer and healthier. So the second most important number on a long, healthy life, BMI. Keep it under 30, close to 25. And the last most important number to have a long, healthy life, actually it's two numbers. It's 7-Eleven. People always go to me, 7-Eleven? What does that mean? That's the store? No, 7-Eleven. If you're a gambler, you know what 7-Eleven is. When you're shooting dice at a table called craps, if you shoot a 7 or 11, you win. You are lucky. And that's the third important number, luck. I know a guy, healthy, works out, great shape, took his nutrition, kept his BMI at 25, exercised, never smoked, sitting on a railroad track, airplane engine falls on his head. Not a long, healthy life. Bad luck. So you gotta have good luck in life too. By the way, I made that up. It's a made up story. But it proves my point that the third number is luck. Hopefully, don't smoke, keep your BMI under 30, close to 25, exercise, live a healthy lifestyle. Cross your fingers. And if you're lucky, with those numbers, you live a long, healthy life.